Assalamu alaikum. This is Dr.Farhana Siddique, lecturer, Department of Community Medicine in Bosundhara Adin Medical College. Today, I would like to talk about a very important topic, that is family planning. Here I go. At first, we know what is family. It refers to or more individual who depend on other for emotional, physical and financial support. Now, family planning. What is family planning? Family planning to regulate the number and spacing of children in a family through the practice of contraception or other method of birth control. And family planning method, that is a way of thinking and living that is adopted voluntarily upon the basis of knowledge, attitudes and responsible decision by individuals and couples in order to promote the health and welfare of the family group, thus contribute effectively to the social development of a country. This is the picture showing the comparing effectiveness between the many other methods of family planning. Now, purposes. Raising a child requires significant amounts of resources such as time, social, financial and environmental. Planning can help assure that resources are available to improve the health of the mother and child, helping to prevent HIV or AIDS. Criteria for an ideal contraceptive. It should be safe. For use means free from any kind of side effect. It should be reliable, it should be easy to administer and convenient, it should be cost effective and it should be culturally feasible and acceptable. Here the method of contraception, that is divided into two major methods. One is a specific method and another is terminal method. Terminal method includes vasectomy and tubectomy, and the specific method includes natural method and barrier method. Barrier method also subdivided as physical barrier method, chemical barrier method, intrauterine devices, hormonal method and post-conceptional method. Today class we would like to talk about the spacing method that help in prevention of pregnancy as long as they are used. This method can help in timing and spacing of pregnancies, preventing unwanted children. This method are temporary method. Natural method. Natural method do not involve use of any of the man-made devices. This method are useful for timing and spacing of pregnancies. That includes coitus interruptus or withdrawal method. In this method, the pain is withdrawn from the vagina before ejaculation. In this way, semen is prevented from entering the uterine cavity and pregnancy does not take place. Merits of this method involves no cost, it does not require any other device with self-control and discipline, and demerits are require a great deal of self-control, thus failure rate is very high. Slightest delay in withdrawal can lead to pregnancy. Another method is safe period. Based upon the process of ovulation and menstrual cycle, which helps in determination of the safe period when coitus can be done and unsafe period when coitus can be avoided to prevent pregnancy. Merits include does not require any man-made device, and demerits are require self-control, not suitable for women who does not have regular period, failure rate is high and require great deal of willpower and motivation. This is the picture of a safe time using the calendar method. Now, barrier method. Barrier method are those methods which prevent meeting of sperm with the ovum. These are major types of barrier method, such as physical barrier method that includes condom. It is a thin rubber sheet which is used by men. It is rolled over the erect penis before having sex. And merits are, it is the most simple and effective method, easy to use, disposable, no medical supervision is required, protect from sexually transmitted disease. And demerits are, if not used correctly, it may slip or get tear up and the semen gets split into vagina. In some rare cases, the person may be allergic to the rubber. Some people may not enjoy sex because of interference with the sensation. Now diaphragm. The diaphragm is used by women in her vagina to form a barrier in front of the cervix. It is a dome shape and is like a shallow cap. It is made of soft synthetic rubber or plastic with a stiff but flexible rim around the edge. It also known as Dutch cap. Diaphragm available different ranging. It is held in position partly because of the tension created by the spring and partly because of the muscle tone of the vagina. Merits of a diaphragm includes it along with spermicidal is very effective, failure rate is low, there is no risk or kind of contraindication. Demerits are it requires the assistance of doctor and any other health personnel. It requires privacy and time to place in the vagina. It requires periodical checkup. It requires facilities for its proper care and storage. Another is vaginal sponge. It is a small polyurethane form of sponge diffused with spermicide. The sponge is shaped in a way that it can be filled onto the cervix and has a loop on its outer surface which can be to pull out the sponge after use. Should be inserted before the coitus, provides protection for 24 hours. It should be there for at least 6 hours after coitus. Sperms are trapped in the sponge and are destroyed. It is better than not to use any method. Now, chemical barrier method. This method usually kills the sperms and this way chemical contraception helps in preventing pregnancy. The chemical contraceptive which are in use, the foam of tablet, aerosol, cream, jelly and suppositories. Merits are they are easy to administer, available free in health center, not very expensive, and demerits are most of them inserted deep down in all such points where sperms are likely to reach. Must be applied each time before sex and may cause irritation and burning. Thank you all for your patient hearing. Allah Hafiz.